It's supposed to stop skyrocketing insurance premiums, but healthcare reform may be doing exactly the opposite.
Or at least that's what the insurance companies are saying. Our colleagues at the Wall Street Journal reporting front page today that many health insurers are blaming the healthcare plans, saying that it will cause significant rate hikes on consumers in just a few weeks.
Joining us now is Dr. Sreedhar Potarazu. He saw this coming a mile away and says the increases that have been announced are just the beginning. So, Doctor, a lot of people say that what's happening is eventually these insurance companies are expecting price control, so they want to get in as much of an increase as possible before that happens. Is that what's going on here?
Don't hold your breath, David. I mean, I still predict that there's more to come because the government took on a war here and is essentially like handing a surgeon a butcher knife blindfolded and say, go at it, without sort of a laser sharp approach to this problem. And they went ill-equipped in terms of trying to determine how to control the insurance companies. And right now, there's nothing to catch the tiger by its tail. The insurance companies have got to make up for taking on these additional dependents, the people with pre-existing conditions. And there are no measures or regulations in control right now to hold these insurance companies accountable. So I don't see anything changing in the near term.
Doctor, listen, when I read this article on the front page of the Journal, I thought to myself, well, isn't that typical of insurance companies? You know, way before this health care plan was ever floated, they were hiking premiums by 20, 30%, 40%. Now they use this as an excuse. It's an outrage on behalf of small business owners, many of whom have said to us right here that they saw their premiums jump double-digit percentages even before President Obama was the president. They will use anything for an excuse. What do you have to say to that?
17% in some small businesses, and absolutely. And so if we are looking for the economy to respond with these small businesses starting to hire or wanting to hire, they can't do it because healthcare costs have gone up dramatically. So that's a major deterrent.
But I guess what we're saying is for the health insurance companies to turn around and say, well, the health care bill did it, forced us to do this. That's just an outrageous lie because they've been doing this for quite some time. Ask any individual who has that kind of insurance or a small business. They've endured this no matter what.
There's no question about it. And nobody's going to hold them accountable to even stopping. So the businesses, what I said a year ago and even more, the businesses that are paying these insurance companies still have not got the necessary insight to ask the insurance companies, why are you charging me that? What is behind those costs? They're helpless. And so the insurance companies basically come back and say, this is your premium, take it or leave it. These are your doctors, take it or leave it. And the market is beholden to them.
But with an interventionist government such as we have now, you know they're not just going to sit back and take it. They are going to try to intrude somehow in the marketplace, as they have time and again before, and affect these rates with price controls. Now, what that means, of course, whenever you have price controls, you have elimination of services. A lot of people say, the heck with it, we can't afford it. You're going to have fewer insurance companies, aren't you?
The insurance commissioners, and the regulations are still not written, have tried to put in place the price controls. But the challenge is that if they go too far, then individuals might pick the exchanges, which means that the burden on the states goes higher. The other thing that the insurance companies did is to narrow the networks. They've thrown some doctors out and limited the choice. So President Obama's statement about keep your coverage and keep your doctor, well, in many places, your doctor's not on the plan anymore. And that's been the way that insurance companies respond to this, have limited those networks. So they've gamed the system in order to survive, and they're going to continue to game the system. I don't see a headline anytime soon in the Wall Street Journal that says insurance companies lower their premiums. I'd love to see it, but I don't think it's going to happen.
Bottom line is it's not cheaper and it's not more efficient now as opposed to before the health care bill was passed.
It's not. We're almost 6 months out from when the law was passed, and things are not looking better. In fact, they're looking worse. So this is going to impact the elections, if you ask me. I mean, I think the timing is a little eerie.
Dr. Sreedhar Potarazu, CEO of Vital Spring Technologies. We'll see you next time. Thank you.